All right, we're back again with Fox 10 News investigative reporter Brendan Kirby for another COVID information segment. And with schools thinking about how to handle the next school year, an important consideration, Brendan, is just how much kids can spread COVID-19. Tell us the latest, please.
Well, Byron, scientists are unsure. The evidence has been mixed. On the one hand, the World Health Organization's chief scientist over the weekend told the BBC that children are a relatively low risk to contract the disease and are also a relatively low risk to spread it. Researchers in Britain and Australia, summarizing available evidence, wrote last week that COVID-19 cases are low among children and that they play a more limited role in transmission than originally feared. On the other hand, a study published in the journal Science last month found that while children younger than 15 are less susceptible to the novel coronavirus, social distancing rules alone were insufficient to stop outbreaks in Wuhan and Shanghai in China. The researchers found school closures can reduce peak incidence of COVID-19 by 40 to 60%. This is mainly because children in schools have so many more contacts than adults do in a typical day. Another study by German researchers looking at a group of 47 infected children between the ages of 1 and 11 found that even the ones who showed no symptoms had just as much of the virus in them as children who did not have who did have symptoms, and also adults.
Wow, okay. Now, this question's been kicking around for a while. There's been a lot of talk that heartburn medication might be part of the solution to the virus. Tell us about that.
Yes, Byron, while Pepcid AC might be effective in treating the coronavirus, there's been research that's been ongoing for weeks now. New York hospitals as far back as April have given heartburn medication to patients intravenously as part of a clinical trial. Doctors administered famotidine, the active ingredient in Pepcid, to patients in 24 New York City hospitals. The idea comes from anecdotal evidence in China, where the drug seemed to have positive effects. If it's successful, the upside is that the drug is cheap and plentiful, and scientists are well aware of any potential side effects. Now, this is interesting, Byron. Lower income folks in China who were administered this drug did better than wealthier Chinese patients who were taking a more expensive drug. So there seems to be a little bit of hope in this.
Well, a lot of us just might be immune by now after taking all that heartburn medicine over this time. Brendan Kirby, thanks so much. Brendan will be back on Fox 10 News at 9 to answer more of your questions about coronavirus. And if you have a question, just email Brendan directly at brendan.kirby@fox10tv.com. He's going to try and answer every question that he can get to.